Myth number 8, you can't trust those people who make these vaccines, big pharma. Those people who develop these vaccines are just out to make money, and they're paying the doctors to say their products are safe. What do you say about that?
Well, the fact is that while there are terrible and reprehensible examples of drug companies putting profit before safety, for example, most recently by aggressively promoting highly addictive opioid painkillers, the process for developing these vaccines and the makeup of the products themselves has been transparent, with more information available to independent scientists than ever before. The development of these vaccines has been carried out in the public's eye. In fact, reviews of vaccine safety and efficacy, which is a term used to mean that the vaccines work, have been published for anyone to read. That means that you or your doctor can read the reviews and decide for yourself whether the research seems solid and the findings are believable. The people reviewing the research include medical leaders from diverse settings all over the country, and observers, which just means they're non-voting members, representing a wide range of medical groups, including some of that have fought very hard against medical racism. They've not been paid for this work. They have been involved to verify the quality of the research and to assure that equity is being protected throughout the process, but they do not get paid. For a list of names of the reviewers and the places that they work, you can visit the Advisory Committee on Immunization Practices, also known as ACIP, at their website, where you can learn more about these people. You can also look them up online. Doctors do not make extra money for giving vaccines. They are paid for a medical visit just as any other primary care visit.
Thank you. That makes me feel better. Thank you, Dr. Gonzalez. Myth number 9. Black and Latinx communities are being singled out to get the vaccine because it really hasn't been proven to be safe.
Thank you for that question. The fact is that there are certainly historical reasons for both Black and Latinx communities to fear being singled out. The concern is justified because people of color and marginalized groups have in the past been coerced and subjugated to participating in drug trials and medical procedures without informed consent, without patient protections, and without really ethical practices. But that's not the case here, however. Black and Latinx communities have not been singled out to get the vaccine. But groups are being offered the vaccine based on the risk factors faced by the people in said groups. So the answer is no to singling anyone out, but yes, it's possible that Black and Latinx communities could be offered the vaccines earlier than other communities where their infection and hospitalization rates have not been as high. But consider the following. The 2 vaccines now available were tested on diverse populations. In fact, the efforts were made to assure inclusion of Black and Latinx volunteers in proportions that were equal to their proportion in the population, just to make sure that there weren't factors that we couldn't anticipate that would make vaccine less effective or less safe in either of those groups. So a big effort was made to include members of those groups to assure that there would not be, that they wouldn't become victims of medical neglect, which is on the other side of the coin in regard to medical racism. The very top priority for getting vaccinated now that the vaccines are available are frontline workers in healthcare. So this includes clinical staff such as doctors, nurses, therapists, as well as people who work in other areas like laboratories and hospital environmental services. They're prioritized because they're at higher risk of being exposed to the virus, and they're critical to keeping other people alive. So these same criteria are being used to decide who is next in line, as we need to prioritize vaccinating some people before others for as long as there's going to be continued limited supply of the vaccine. But once there's plenty of vaccine available, everyone who wants to get vaccinated should have easy access to the vaccine. But again, there is good reason for Black and Latinx communities to demand equal and early access to vaccination. Black and Latinx residents, along with Native Americans and Native Hawaiians, have been most likely to be infected, often as a result of poor working or living conditions, are most likely to require hospitalization if they are infected, and also most likely to die from COVID-19. They're also the communities that suffer the most severe consequences if the illness excludes them from the workforce. So if you see billboards or hear advertising encouraging Black and Latinx residents of LA County to opt for vaccination, it reflects these concerns. LA wants to be, LA wants all of those who have been the hardest hit to have the opportunity to be vaccinated as soon as possible. The fact is that the stakes for Black and Latinx residents are very high. I encourage everyone to read what you can about the vaccines from reliable sources and to talk to well-informed people that you trust. It could be your doctor, a science teacher that you know, a pharmacist. Ask them to respond to your questions and to your concerns. Your questions are very important and they deserve to be answered by knowledgeable and trusted individuals. Again, I hope that individuals consider the Department of Public Health knowledgeable and credible source. We do have a vaccinatelacounty.com website where we answer a lot of information and also have a link to scheduling your vaccine once you become one of the groups that's eligible for it. So again, I do encourage everyone to visit our website and or talk to someone that you know and trust who is knowledgeable and can give you answers to your questions.
Thank you, Dr. Gonzalez. Thank you. Myth number 10, our last one, is something that I have heard so many times from so many people. And the myth is, I don't need the vaccine if I already had COVID-19. Is that true, Dr. Gonzalez?
Well, the truth is that we don't know how long natural immunity, which is the immunity you get from having been sick, how long that lasts. We also don't know if it's complete. There have been a few well-documented cases of people being infected twice. So even if you have had COVID-19 and recovered, you can still benefit from the vaccine, and we still recommend those individuals receive it.
Wow, wow. Dr. Gonzalez, you've answered the 10 myths, and I am so pleased that you have been with us. I know that the people watching this program are going to be so relieved to know about the 10 myths and how they are not true and how important it is to get our COVID-19 vaccine. So thank you so much, Dr. Gonzalez. Thank you.
It's been my pleasure. And thank you so much, Board Member Schmelzen, for taking the time to provide this valuable information to your residents.
Okay.